please close your eyes and listen to this little scenario that I'm going to tell you about. You are awakened by a strange smell, yet it seems so familiar. But at the same time, you're not sure what that smell is. You look around you and you see children and adults laughing and talking, and you're wondering, who am I? Where am I? Then a lady walks up to you and said, "Good morning, Mom. You're awake now? Would you like a cup of your favorite coffee?" Now you're thinking, am I old enough to have a girl that age? Well, guess what? This is the mind of a person with dementia. Tonight, I'm going to tell you a little bit about dementia, the signs and symptoms, and if it's preventable or treatable. I will start off by explaining what dementia is to those of you who are not familiar with it. Dementia is not a specific disease, but a disorder. According to medicine.net, dementia has a broad description, which includes not just memory loss, but word-filling difficulties, impaired judgment, and problem with day-to-day activities. This is caused by injuries to the brain and the brain cells. According to Mayo Clinic, dementia affects people in different ways, depending on which part of the brain it affects. Dementia involves damages to nerve cells in the brain, and it can occur in several areas. This disorder is often grouped by what they have in common, such as the part of the brain that is affected. It can be caused by vitamin C deficiencies, reactions to medication, brain tumor, or infections. But these causes can be treated and improve over time. But there are certain diseases that are not reversible or treatable. These diseases include Parkinson's, Alzheimer's, and Huntington's disease. Dementia is a very complicated disorder to understand because there are different types of dementia and how it affects the brain. Dementia is a disorder that affects a person's cognitive, skill, and psychological behaviors. Now that we have looked at what dementia is, let's look at some signs and symptoms of this disorder. There are so many different signs and symptoms that a person can experience, depending on what part of the brain it affects. There are also factors that may trigger this disorder. A person with dementia can experience memory loss, difficulty communicating or finding words, as well as difficulty reasoning or problem solving. These signs are usually noticed by a spouse or someone who are close to them and know them very well. Other signs can also include having difficulty with planning and organizing tasks that they once know very well. A person with dementia can or may have personality changes, such as depression, anxiety, agitation, hallucination, and inappropriate behaviors. Now that we know the signs and symptoms of dementia, let's look at the two categories of risk factors. So the first category of risk factors are ones that we can change. And these are your day-to-day activities, such as alcohol intake, smoking, blood pressure control, diabetes, and depression. The second category is something that we cannot change, which is our age, family history, Down syndrome, and mild cognitive impairments. So everyone, if you have these habits that you can change, please do so. Now that we have looked at the signs and symptoms and risk factors, let's talk about the different stages of dementia. So there are 5 stages. The first stage of dementia is probably not noticeable because it does not really have any effect on the patient yet or the person. The second stage is still questionable to whether the person is having any difficulty or not, because he or she is still able to function independently. Now the third stage, the person is probably beginning to be more obvious. The person may show some difficulty with daily activities, but still able to function. Now the fourth stage, it is moderate impairment to the person. He or she will probably need help with caring for himself or herself, as well as doing daily activities. Now the fifth stage, this is the late stage. It is the most severe stage, where the person is totally impaired and is unable to function independently anymore. It's going to require help from loved ones and or facility staffs. So according to all these research that I've done, dementia can or cannot be reversible or treated depending on the cause of dementia. It is very important that if you notice any of these signs or symptoms, make an appointment with your doctor or your loved one's doctor so they can get tested. The first thing that the doctor will probably want to do is run some tests. Lab works, brain scan, and cognitive and psychological tests to determine what could be the cause. To be honest with you, the brain is a very delicate organ. Most dementia cannot be cured, but only to treat the symptoms. There are different medications that the doctor may want to prescribe to help with chemical reaction in the brain. And these chemical reactions helps with memory and learning abilities. Once the person is in the 4th and 5th stage of dementia, all we can really do is modify the environment so that way it's less noisier, less noise, and maybe repetitive routines where the patient cannot get confused. Now that I have shared with you some basic facts on dementia, I'm hoping that this will give you a better understanding on this disorder. Remember, this disorder affects the brain in many ways, depending on what part of the brain it affects. So not everyone with dementia will act the same way. I hope that with the information that I have provided you tonight, if you see anyone with this disorder or notice it, please give a helping hand. Thank you.